Hours after arriving at Massachusetts General Hospital, Dan Hammond has gone blind in his right eye, and it seems as though he's rapidly losing sight in his other eye.
And now this was just a revelation to me that, like, wow, I've lost my right eye, and now my left eye's going the same way. I'm going blind.
But when ophthalmologist Dr. Stephen Foster arrives on the scene, he's more concerned about finding out what's causing Dan's temperature to spike at 103 degrees.
First and foremost on everyone's minds was infection, and we felt that since that can be fairly rapidly lethal, it's mandatory to exclude that.
Dr. Foster orders a full battery of emergency tests, hoping to find the source of Dan's bizarre symptoms. 2 hours later, the results are in.
All the cultures that were done for the highly dreaded infectious potential causes were negative. So, in fact, this was not infectious.
Suddenly, Dr. Foster is back to square one. If it's not an infection coursing through Dan's body, he speculates that the root of the problem may lie in his blood vessels. He immediately performs a vitrectomy, a process in which an entire layer of the damaged eye is removed to see if the arteries feeding it have become inflamed.
It was obvious that there was inflammation of the blood vessels in the retina.
But Dr. Foster suspects that the inflammation is not just limited to Dan's eyes. He fears that the blood vessels throughout his entire body could be inflamed as well. If this is in fact the case, Dan may have only hours to live. Dr. Foster wastes no time. Right away he preps Dan for an angiogram, a specialized X-ray to view the inside of his blood vessels.
Angiograms were done of his major vasculature, arterial tree, by catheterizing lower portion of the aorta.
24 hours later, when the results come in, Dr. Foster is finally able to pinpoint exactly what's been causing Dan's body to fall apart.
And specifically, it was clear that the primary tree, so to speak, of the vascular system that was predominantly targeted was the arterial tree.
Dr. Foster calls Mary into Dan's room to give them the answer they have all been desperately waiting for.
This was an autoimmune polyarteritis nodosa.
Polyarteritis nodosa, or PAN, is a rare and particularly lethal autoimmune disease. For an unknown reason, rogue immune cells randomly attack and inflame the arteries, veins, and capillaries that carry blood to and from the heart. When these blood vessels become inflamed, blood flow slows down, cutting off the supply of oxygen to the surrounding tissues. Ultimately, any organ associated with those vessels shuts down entirely.
And what that is, a kind of vasculitis where it's the arteries or your vascular system that your immune system starts recognizing as an invader and starts attacking. So in my case, it was the arteries to all various systems of the body that the immune system started trying to take down.
So it seemed clear that this patient had an arteritis affecting other organ systems, skin, bowel, and otherwise.
Dan is a classic example of how polyarteritis nodosa can overwhelm the body. The inflamed arteries caused the rash on Dan's neck, the swelling and discoloration in his legs, and his high fever. Finally, the disease spread to blood vessels in his eyes. It's clear that Dan's body is surrendering to the disease at a breakneck speed, and Dr. Foster has no time to lose.
Polyarteritis nodosa has about an 85% death rate if the patient is not aggressively treated. This was a life and death matter. The medical team at the Mass General swung into action very rapidly with high-dose intravenous corticosteroid therapy.
The corticosteroids should reduce the inflammation throughout Dan's vascular system and stop the immune system from attacking any more blood vessels.
It just shuts the whole immune system down and renders you almost completely immune suppressed very quickly.
Now the only thing they can do is wait and hope that the treatment will help save Dan's left eye and his life.
Within 24 hours after starting the prednisone, there was no further decline in the vision. So that was a huge relief. Because at that point I'm thinking I may not be able to read, but I can still make out my kids' faces.
Over the next 3 days, Dr. Foster closely monitors Dan, and it seems as though the steroid treatments are truly working.
The legs stopped hurting for the first time since before the surgery. The fever went down. The rashes and the other dermatological problems, they receded pretty quickly after that.
It felt right. Okay, now we've got the answer. Good.
I think everybody breathed a big sigh of relief after 2, 3, 4 days that in fact he was not going to be at death's door.
Finally, after days of being in the hospital, Dan is discharged from the critical care unit. And while he's thankful to be alive, Dan must now deal with the realization that he'll never see the world in the same way again.
Well, the right eye, unfortunately, was irrevocably damaged from the arteritis, infarction of the retina, and he will never see again with that right eye.
Dan is told there's a very slim chance that, over time, he may regain some sight in his left eye, but Dr. Foster is skeptical.
Well, you never know exactly what to expect. The hope was that it could be resurrected.
But 3.5 months after he is discharged from the hospital, Dan experiences something completely unexpected.
You know, I sort of come to grips with the idea that it's just not going to get much better. Then I remember somebody left the newspaper and I was bored, so I scooped it up and started reading, and was reading a movie review, and I remember it was about 3 or 4 paragraphs in when I actually brought myself up short and said, what am I doing? For the first time since it had all happened, I found I was actually able to read something.
Today, 5 years after he was diagnosed, Dan can see quite clearly with his left eye.
The left eye is now 20/25, which is outstanding. I mean, that's just one line less than 20/20. He can see and do everything he might possibly want to see and do with that one 20/25 left eye.
PAN rarely shows up in the eyes, or at least rarely goes after the eyes early in the game. It usually goes after other more fundamental systems first. So kind of the ultimate good news, bad news scenario. PAN really should not have cost me my vision, but it should have killed me.
Dan still marvels at how close he was to death, and wonders why no other doctor was able to put all the pieces of the puzzle together.
Polyarteritis itself is so uncommon and so commonly not recognized and diagnosed definitively and treated aggressively early enough to save the patient's life, so that the diagnosis is commonly made at autopsy.
There was a real possibility he wouldn't be here, and I always remember how lucky we are.
I consider Dan cured. He's never had another problem since, and I don't think he ever will.
To get this twice would be like getting hit by lightning twice.
Today, Dan and Mary are back to their normal, hectic lives, juggling work and making more time than ever to spend with their 3 10-year-old children.
Something like this makes you step back, makes you appreciate that you have 3 beautiful kids and you do get to watch them grow up.